Brilliant. I will now make sure that we can all see your presentation. So underneath,
Oh,
you can. There's a button which says next slide, so you can be in charge of that, Isabelle.
do you have a good connection? Because
I hope I do have a good connection, but the main thing is for you to have a good connection.
okay, I hear you. I don't see my image moving, but if you do, it's fine.
Yes, I can see your image moving, but we are now seeing, which is the main thing, your presentation, Isabelle. So,
Okay,
yeah,
great,
so that's how it should be. That's what I'm saying. That's how it should be.
wonderful.
So I will just say one or two words about yourself, and of course you can say a bit more. So I'll start in Polish, if you don't mind. Więc witamy kolejną prezenterkę. Izabel z Francji. Izabel jest terapeutką poznawczo-behawioralną, ale także terapeutką CFT. So Isabelle, I said that you're a CBT therapist, also CFT therapist, and if you would like to say a bit more about yourself, you're welcome to do so. So the floor is yours, so to speak, Isabelle.
Thank you very much.
Thank you for being here.
Yes, I'm a therapist. I've been working in a private practice for 20 years, and I've done a PhD. And I'm going to propose to you to do a little exercise that I call the smile exercise. And I created this exercise in my to study and research in my PhD the links between connection and compassion. So, and today I'm going to present to you some example of micro skills, some motivational systems around connection and compassion, and also some psychopathology. So if you would like, I invite you to take a comfortable position. If you want to stand up because you've been sitting for a while, feel free to do so. It's just a short exercise. It will last for only 5 minutes or so. So if you're sitting, you can connect with the feeling of your feet on the floor. And during this exercise, you will see that my English is not perfect, so that's a good opportunity to work on welcoming imperfections. And you can also remember to treat yourself with respect. And if my words are not what you need, you can change them for something more appropriate to you. And so you can just relax a little bit and find a comfortable position. And we're going to focus on the breath for a few seconds. And you can just notice your breath. And maybe put one hand on your stomach and one on your belly. And you can inspire by inflating your belly without forcing the inspiration, just living natural. And you can exhale slowly and deeply. And maybe notice that this movement is a bit like a wave that swells and gently stretches on the sand. And you can find a gentle pace for your breath. Very good. And if you want to, you can close your eyes. And you can welcome an image of a caring person, maybe someone you know or someone you imagine, but it's someone that has your well-being at heart. Maybe could also be a fictional character or a symbol like the sun. But you can see this person is smiling to you. And you can notice the shape of the mouth. And if the eyes are narrowing or if they are shining. And you can also imagine the atmosphere of the moment, maybe some perfume or some music. And take a moment to notice how you feel on the inside. Do you feel like smiling too? Sometimes we can feel some kind of energy or warmth. Just notice what appears. Very good. And now you can notice how is the relationship. Do you feel connected to this person? And before you finish this exercise, you can come back to your breath, and if you want to stretch a little bit, and come back to this moment to think about what you've just experienced. And I'm going to say a few words now about connection and compassion. So before that, I would like to invite you to think about two laws of how the universe is organized. And this first law is entropy. I don't know if I should do something to switch the slides. Maybe diapo suivante. Okay, I get it. Thank you. And entropy is the fact that when a system is open, the information that is inside this system will move in an unpredictable way, an disorganized way, and it will bring some transformation in the system. And we can, for example, see entropy. If we drop some chemicals in the water, the chemicals will go all over in the water. And sometimes we also call pollution. An example of entropy is when, for example, a factory is spreading some chemicals in a river. You will see the chemicals go everywhere on the earth and find these chemicals everywhere. So this is something that is complicated for living beings because the more the environment is changing, the more it asks living beings to adapt to it. And so it's always stressful and complicated for living beings. So suffering in humans is very much related to that because the mind is also an open system. And you can find a very interesting definition of the mind in this book from Daniel Siegel, where he proposes to think of the mind as an open system. And when the transformations happen inside the brain, there will be suffering if there are blocks, and what will emerge are symptoms of chaos and rigidity in the face of these changes. We can also think of trauma as the events that are impossible to integrate in the body, in the mind, or in the culture. So that is for entropy. Another law that organizes the universe is synchronization. This synchronization can be observed in very small organizations of entities or very large scale, as for example in planets. An example of that is the fact that the moon can always be seen from the same face. Why is that? It's because the moon is turning at the exact same pace as the rotation of the Earth. And this happened through synchronization. The moon is, as the speed of the moon has influenced the speed of the Earth, and reciprocally the Earth has influenced the speed of the moon. And so they ended up to have this exact same pace of rotation, the moon around the Earth, of course. And another example of that is the image you can see of birds flying together, and they influence each other's pace and each other's direction. And this synchronization is something that has been very hard for mathematicians to modelize, but they were able to. It is made through nonlinear models, and explains and predicts this type of phenomena. And another example of that is, for example, in concerts, when people gather. I don't know if I can turn it on. There's the music of Adele and on the. I don't have the button to turn in the music on.
Sorry, Isabelle. I think it doesn't work on this. Sorry.
Okay. Well, this was the video of the public singing all together, and you can imagine it. You've seen it, or for example, people clapping together at a concert. Social psychology has studied that type of synchronization, and there are many positive emotions that emerge and positive feelings for humans experiencing that type of interactions. So how is synchronization possible? Synchronization needs connection. And I'm going to take a moment to define connection, because we use this word a lot, but it's not always clear. And the connection is a material, physical, and tangible concrete link between two physical, biological, or mechanical entities. This link induces a reciprocal exchange of information. So what does that mean? That means that really the information has to go back and forth between those two entities. And in human beings, in the relationship, the synchronization will need connection. That means it will need attention, shared attention or joint attention. So we can see in therapy, for example, the mindfulness of the therapist will increase the connection between the therapist and the client. But the client will also need to be connected to the present moment, to the therapist, and to his own suffering and emotions, which is not always the case. But what emerges when there is connection between therapists and clients is that it will facilitate approach behaviors, and there will be a more open attention. And as you see in this experiment, the kids are more willing to cross this gap, visual cliff, with a visual cliff, and to reach their parent if the parent is smiling. So in therapy, if we have clients that is not bringing attention to their emotion or to the therapist, for example, with avoidance behavior or dissociation, it will not enable this connection and this process of synchronization. In those pictures, you can see me in the middle at age 15. At that time of my life, I was quite depressed. And you can see on the left that I'm really not connected to the people around me. I am not connected to myself either. I am mind wandering. And of course, on the right, you see me more connected. And of course, it's the right picture that I sent to my parents and to the people around as a memory of the holidays. But very often we can see in our clients that they are not connected. We can be disconnected from our own emotions and suffering, but we can also be disconnected in the relationship. So I guess we won't see this video either. This video was a video of social stress. It's an experiment, cyberball experience. I invite you to go on the web and to see the video. It's just someone who is sending a ball to someone, and he thinks it's a real person. And this person is sending the ball to a third person. And after 2 exchanges, he will no longer get the ball. And the 2 people will play together, not sending him the ball. And this person, he's having a very strong emotional reaction of anger, of lowering of energy, and also of feeling powerless to trying to get the ball and not being able to do so. And social stress is experienced as rejection, but it's also experienced as thoughts of something's wrong with me, I'm not enough. Or also the person will experience pain in the body. And research has shown through these experiments that there are also modification in the blood-brain barrier with that induces pro-inflammatory reactions. And you may also know the research showing that isolation is a causal factor for depression. So the fact that we are able or not able to connect with others around us is really key to our well-being. And when we look on the other side at research on love, love can be considered as an emotion. And Barbara Fredrickson has shown that there are 3 factors for this feeling of love. And the first one is the synchronization of positive emotion. The second one is the synchronization of behaviors. And there is also a joint attention toward well-being. So love can be thought as an emotion, but it can also be thought as a motivation toward connection and toward this synchronization. And so love and connection is not the same as compassion. The difference is that compassion is a motivation to connect, but to connect to suffering. What happens in therapy is that the clients and the patients, if they are both motivated for compassion, they are connected to suffering, and the synchronization will happen very easily. But if the client is avoidant through, for example, addiction or using drugs during the sessions or having avoidant behaviors, then the therapist may also stop focusing on suffering and focus on the behaviors and try to change the avoidant behaviors. And this situation is no longer a situation of connection. And it may bring resistance and conflict in the therapy room. Another situation that is not compassion, but will bring some connection, is the situation where both therapist and client will avoid suffering. In that situation, I call that a non-suffering motivation. That means we're going away from the suffering, so there is a feeling of immediate relief, but the suffering is not free and it's not resolved. But in this situation where the therapist is also avoiding by, for example, being in abstract thinking, the therapist and the clients may have a good therapeutic relationship. They may feel connected, they may feel synchronized, but they will not improve in the compassion and relieving the suffering. So why is it so tricky to go toward the suffering and to be together in this motivation of compassion? Is because when we try to connect to suffering, we may not be aligned with what we expect. Ideally, in therapy, we want both connection and compassion. And this may sometimes go through disconnection. Sometimes therapists want to step back from the avoidant behaviors, step back from the anxiety or the emotion of the patients to wonder, where is the suffering? I sometimes, when I'm stuck in therapy, I ask the question out loud. If the patient's telling me, oh, I'm staying home and I'm not going to school and I'm watching TV and I'm fine, and I'm like, okay, you're fine, and that sounds good. And is there suffering in this situation? Where is the suffering? If we don't reconnect the suffering, we will stay in connection, but we will not move forward. So when it's tricky, it's when we connect with this suffering, we may meet self-criticism. Self-criticism is well studied, and we know it's the predictor of the development of psychopathology. When we expect something and things don't happen the way we expect them, the suffering emerge, and the self-criticism will come to help correct the situation, eventually control the situation. That's the first function of the self-criticism. And there is another function of the self-criticism that is the hate itself. Hate is an emotion that is aiming to suppress the object of love. And so if I love someone, for example, hate will tell me to destroy this person or to destroy the relationship. And eventually, if it's with myself that I struggle to connect, it may turn toward myself and try to destroy me. So that's the two types of self-criticism that we can meet in when we try to connect with suffering. And when we try to connect to this suffering, there is this entropy, there is this disorganized movement, this chaos, or eventually this rigidity. And what we're trying to do in compassion is to create space for this movement, for this disorganized movement. And when we allow this enough space for this behavior to be, we can reconnect with this entropy, with this disorganization. And from this reconnection, there can be a new synchronization that emerges that will take the form of a validation of this suffering, of the emotion, and will create an integration of this suffering. So thank you very much for following me on that. And I think we have a few minutes. I don't know if you want time for questions, but thank you very much for your attention. Oh, I don't hear you.
So thank you, Isabelle. Thank you so much. And you're quoting one of my favorite philosophers.
I'm not surprised.
So thank you so much for being here. And again, if our attendees have any questions or simply want to share the reflections with us, you're welcome to.
Thank you for sharing the C-bubble too.
Yes, these are the various examples of a cyberball with different groups. So very interesting. So if there are any questions or reflections, we can always share them later, also with the presenters, if there's anything you'd like to say or add. And again, thank you, Isabelle, for being here today.
Thank you for having me. It's really a pleasure.
So hopefully next year we'll be able to meet in not only in person but in flesh. Hopefully.
Wow, that would be awesome. and I can learn more about your book for between now and next year, I hope.
Yes, books plural, unfortunately, because and you'll have to tell me more about your writing as well.
Thank you.
So thank you, Isabelle. I'm afraid today there's the rest of the things that are still happening in Polish. But tomorrow, if you'd like to join us for a session with Joey Weber from the UK, he's going to do a talk on equanimity. You're welcome to do so, of course. So if you have any questions about it, let me know. Yes, merci beaucoup, Isabelle. Merci.
Avec plaisir.